Now I will show you 3 different levels of measurement activity, and you need to tell me where you are. And I would love also for Kareem in the chat to tell me then if his question was answered. But level 1, which is the most easy one, is we go from measuring stuff, for example, how many people visited our booth, to what it means. So honestly, I left out level 1 because it's really something I hate and I cringe on. When people just say, we had the best coffee, or we distribute that many coffee cups, I don't care. You should always be at a measurement level where you at least do this. So I always break it down into activity measure. So I never use the word vanity metric. I think every metric has importance, but there's a difference between activity, operations, and KPIs. If we focus on activity, how many booth visitors did we have? What this tells us is actually booth attractiveness and visibility. To answer Cyril's question, there is a causal link between how well your booth is designed, where it was located, how inviting you are, and then how many booth visitors you have. And honestly, you should always benchmark compared to your previous year. Did we do better? Did we do worse? And try to understand why. Then, because there's some organizations that are very, very financially focused, we could, in theory, but this is sometimes not that easy to do because you need to involve your procurement department as well. And we know how difficult it is sometimes to get that information, is the cost per booth visitor. So what is the total cost of the booth divided by the total number of visitors? Then you have your cost per booth. So this is one way of measuring the success of your booth. I'll just do row 2. And then everything else you can just read. This is consents captured. This is linked to this lead generating activity that I was showing earlier. This is then, what does this tell us? It's actually the rep interaction quality. If we have very few consents captured, then our reps did a bad job. But again, did they do a bad job because they're bad, or because we didn't train them specifically, or because we invited the wrong ones that don't even speak English? That's something you need within your organizations to identify. And then the financial lens is, what is the cost per lead? So what is the total cost to have all those reps there, divided by the number of leads captured? So this is one way of looking at your success and the metrics of the booth. Another way, which I used quite a lot as well at some point because we were at that level, is actually the RACE methodology. So reach, act, convert, engage. This is the moment you start really thinking in journeys. Then it's really about reach. How many people did we get in front of? Booth visitors and symposium attendees is still important, but please, if you speak about symposium attendees, don't speak about the total number of attendees, only about the HCPs, because you can filter that out. It's not interesting that you had the medical director of Lilly, unless I'm wrong, of course, but usually you want HCPs to be there, not your competitors. And then act is what actions were taken. So for example, if someone came to the booth because we sat on the camera, how many of those people were scanned? Based on that, again, I can deduce, okay, were my reps and MSLs active in scanning? Because I want to capture that data. How many consents did I capture? Again, step by step. The conversion is then, did we capture them? Sorry, consent is here then. If we had a medical information request, how many MSL follow-ups did we have afterwards? And how many rep visits were requested during the Congress? And then engage, this can only be measured after the Congress, not at the Congress. This is then how many follow-up visits do we have planned, how many consents were activated, and then how many recontacts meetings did we have afterwards. So for example, even from a medical point of view, you usually have KOL meetings, but there's also all of the follow-up meetings. So this is one way of showing it. And then you really have a journey way of showing it. And then now I anticipate that a lot of people will be scared of the next slide that I will show, but this is ultimately, but again, not everyone can achieve the Olympic level, how you should measure your KPIs. And this is then also how you achieve this very famous, how do you activate change in behavior or change in clinical practice. So on the left-hand side here, you can see that all of those KPIs are broken down. They are broken down, same as the previous slide, in activity measure, operational indicators. So this is sometimes what people call vanity metrics, but for me, actually, this is quite an important one because it still gives you the consequence of what is happening, and then the behavioral KPI. So I'll only focus here on the left-hand side because then otherwise it's too much reading, but you should always link your KPIs to each other and what activity they actually change. So here you have, for example, number of booth visits and symposium attendance. This can be linked to how many of the target HCPs did I reach? Because in the end, again, it's not about your competitor sitting there. It's about your target HCPs being there. And for example, if you don't have your product in China and you have people from China visiting your booth, they are not qualified leads. So in the end, that's not impact. And here what we want to measure is the impact. So it's about filtering out only the HCPs that are within target. And then based on that, I have an HCP target reach. based on the booth as well, I can see how much time was spent on the booth if I have that measurement activated. And this then leads to brand awareness lift. So this can be measured after the Congress, not during the Congress. And also adoption and ladder lift. So how many people did go a level up in the knowledge ladder or in the adoption ladder? And then this combined with everything else that we've done, but again, it's not only attributable only to the Congress, should lead to a change in clinical practice. All of this. So again, I know that not all organizations will be here. This is also not that easy to set up, but all of the things that you measure matter. So having booth visits, yes, sometimes it's defined as a vanity metric, but it actually matters because it leads to everything else afterwards. And then the last thing I wanted to say is, because this was only for the share of voice piece, there's actually the 4 dimensions, if you remember from earlier: share of voice, thought leadership, lead generation, lead nurturing. And as a business KPI, before we go to the Congress, we should know, okay, we want to have a share of voice target. What is the share of voice compared to the budget that we're spending? And this can be measured then by your insights team. So how much message recall was there? And this is also part then of the share of voice. So here, just bottom right, what I want to say as well is, we do not measure what we do. We should measure what it changes at this maturity level. Again, not everyone will be here. And then you should break down activities as you reach, your operational indicators as your exposure, and your KPIs is your impact.